back. You're watching the South African Morning. Now, with the threat of a fourth wave in December or January, health authorities continue to urge people to get vaccinated. The second leg of the Vooma vaccination drive will kick off next week. The government is particularly targeting those over the age of 50. Now, close to 14 million people have been fully vaccinated in the country so far. To discuss this further, I'm now joined by epidemiologist Dr. Joe Barnes. Dr. Joe, many thanks for your time this morning. Let's speak first about that threat of a fourth wave and how imminent it is. Is it something that we could see sooner than January next year?
Good morning to you and to the listeners. I heard a couple of days ago that South Africa's got an upsurge in flu cases. That is a worrying sign because flu, the seasonal flu, and the COVID-19 infection are transmitted along the same ways, that is through the air, through aerosol droplets, most of it. So the flu upsurge shows me that people have been neglecting their personal protection, and that the non-pharmaceutical, in other words, the efforts you can make to protect yourself with a mask and hand washing and so on is slowly being eroded. That does indicate to me that the chances are increasing that the fourth wave will be a little bit earlier than we thought, say maybe mid-December even, rather than later.
Right. Talk us through how severe it could be. I mean, we do have the benefit of vaccines at the moment, but the issue is that a lot of people are still not vaccinated. But I wonder if the severity might not be reduced somewhat just because we've got a vaccination drive going.
I'm really hoping that you are right, because we do not only have vaccines now, but, measured against the first and the second and even the third wave, we are getting much better all the time to treat people who are ill. So our death rate, mortality rate is coming down, and we are getting people out of hospital a little bit sooner. So we have much more effective ways of dealing with it. So that is hopeful that it will bring the peak of the fourth wave down. But it will still, unfortunately, depend on people's behavior. And we are facing the festive season. And one of the big super spreader events are the school leaving parties, the raves, etc., where children or young people seem to think that they are invincible and that the virus won't touch them. I'm really concerned about that. So it's people's behavior, people's willingness to cooperate to help us bring the peak down. That'll call the shots to a great extent.
Doc, do you believe that government and other related stakeholders have done enough when it comes to messaging and encouraging people to get vaccinated? Because we know that one of the big issues is that people are reluctant based on what they see on social media, the misinformation. Do you feel that government has done enough in terms of its messaging strategy and encouraging people to get out there and get their jabs?
I'm probably going to be killed for what I'm saying now, but I don't think so. I'm concerned not only about doing enough, but doing from what corner. Only approaching this as a responsibility that the government must make pronouncements and ran ad campaigns and so on means that all the messages are coming from the government. And we have seen in the last election now that there's a significant move from a lot of ordinary folks that they are not really happy with all sorts of other issues with the service delivery and things like that. So when that same organization is the one that says, please come and vaccinate, it misses some of the punch and the ability to convince people, because it's always the government saying that. We need to mobilize the rest of South African communities where not only community leaders, because many of them are connected somehow to a political affiliation or the government or whatever, but we need to take up the issue amongst our community members ourselves and do it for ourselves.
Right, and ourselves as community members, but also the role of the private sector is quite important here. You've seen corporates, for example, pronounce that vaccinations are mandatory in their office spaces and things like that. And so the role of the private sector is quite important here as well.
I'm concerned that many of the people who make an enormous thing about the fact that they have a choice and that they are choosing not to do it, so we are infringing on their rights if we make something mandatory. Unfortunately, having a choice about a vaccine that of an infection that threatens other people's lives, that choice stops when it threatens your and my lives. So it's difficult to argue with them. Once you've pointed out that the vaccines are safe, then they slide over to saying, yeah, but you're forcing us to do it. Once you tell them, but you know, the law allows for vaccination mandates, then they slide over to another argument. The basic background behind that, the emotion behind that, is fear, distrust, and being influenced by people who count more to them than the community and the government.
Yeah, and that's quite unfortunate, Doc, but hopefully we can see some kind of change coming through. Just a thought from you around booster shots. There's already conversations around the fact that health professionals need to be getting booster shots. I wonder if this is a priority, given the fact that we're still trying to get a large part of the population vaccinated. Doc, what are your thoughts on that?
The booster shots that are given for the health services are not instead of somebody else being vaccinated. We have enough vaccine stocks now to get us through to our benchmarks that we want to reach. So giving a booster shot to your frontline workers that have got to cope with the next wave is not standing in front of the queue for somebody else. So and the second point is that those staff members are desperately needed for the coming wave. They are our really the thin line in the front that's holding the enemy away. So we really need to protect them. And the original Sisonke trial, the J&J vaccine that they got, is more or less run out of protection by now. So we are going to have to make them face a new wave of infection while their own protection is slowly winding down, which is also unfair. So I'm very happy that they're doing it. I got mine yesterday. So I'm very happy that they're giving the frontline workers a booster shot for that, because it is important that our hands on deck are protected.
Right. And then just a final word from you, Doc, around this idea that COVID is here to stay. We are speaking about a fourth wave currently, but South Africans need to understand that there'll probably be a fifth, a sixth, a seventh wave, and so on.
Yes, it's going to become endemic. It's going to stay with us like this, like another form of seasonal flu. And I'm really hoping that these waves will all go flatter and flatter as we learn how to cope with it. And by the way, they're developing a new family of vaccines that will hopefully last longer. And humans are ingenious, and we have wonderful scientists across the world. They're working on newer and better and stronger vaccines for us. And hopefully one day we'll come to the point where we can just have every second or third year an injection, or even they're working on patches that they can put on people's skin. And so there are all sorts of, there's hope in the future if we can just stay the course right now for the next few months and do what's asked of us.
Dr. Barnes, thank you very much for your time this morning. Dr. Joe Barnes there, talking us through that fourth wave and the fact that South Africans have become very lackluster when it comes to following COVID-19 protocols. Of course, as the fourth wave comes, people are being encouraged to vaccinate and to also wear your mask, social distance, and continue to sanitize. Thank you very much for your time there this morning.